Hi, I'm Jonathan Fillmore. I'm one of the oral and maxillofacial surgeons here at Mayo Clinic. I actually grew up in a small town in Maryland, and then after that attended Brigham Young University for my undergraduate studies. I actually studied French there, and then I was fortunate enough to go to Boston for my dental school. We then came to Rochester at Mayo Clinic for my surgical training as well as my medical school, and I felt like I just had such a wonderful, well-rounded training and just had really great mentors while I was here. I'm grateful for the opportunity I had to study and learn and that I still have to practice here at Mayo Clinic. And I love the values and ideals that the institution embraces, as well as the individuals who try and live out those ideals on a day-to-day basis in all their patient interactions. It's just been a really great place to work. My family, which is my wife and 4 kids, have really come to enjoy Rochester very much, and we're so glad that we've made Minnesota our home for well over a decade now. It's been really great. I felt drawn toward oral and maxillofacial surgery as a specialty because of the complexity and the variety in treating conditions of the face and jaws and neck. It's a great specialty that bridges medicine as well as dentistry, and I feel like I can really make a difference that really matters for people in this specialty. Now, much of my career is focused on temporomandibular joint surgery, also known as TMJ surgery, but I'm still active and really enjoy other types of surgeries, such as orthognathic surgery, sometimes called corrective jaw surgery, facial trauma, benign cysts and tumors of the jaws, and a wide variety of other conditions, whether it's in adults or children. I really try to care for my patients the way that I would a family member. I feel like that's the standard that I try to set. One of the other things that I'm particularly proud of with our practice here at Mayo Oral Surgery is the multidisciplinary and team approach that we have. For example, I have a TMJ surgery clinic that's multidisciplinary, that we have lots of other providers and patient education that we come together to try and care for really complicated cases. We treat our head and neck cancer and our medically compromised patients in the same way, with a big team of doctors and nurses and all kinds of providers who come together to really meet the needs of that patient in a more complete way. We collaborate with our orthodontists to provide really great outcomes for our jaw surgery patients, and I feel like that collaboration is really satisfying, and the way that we serve our patients together really makes this job worth it. I really enjoy that.